This is Hub City Spokes, where creators, catalysts, and leaders share their insight in Lubbock, Texas. This season, we're speaking with local businesses discussing their response to these changing times. Thanks for joining us. We have Rodney Madsen here, with CEO of GermBlast. Thanks for joining us.
Absolutely. My pleasure.
So GermBlast, their mission is to eradicate illnesses from your everyday life. Obviously, that's something that is certainly on the minds of people right now. Can you tell us a little bit about GermBlast and how you got started?
Well, I've always been in healthcare. It's kind of the only thing that I've ever done. In 1993, I started in healthcare, primarily in acute care, life support equipment. I opened my own business, which was Affinity Healthcare and Affinity Distribution, back in 2000. And in 2006, a partner of mine, Josh Underwood, and I, we started a company called DermaCare. And DermaCare was just a unique opportunity for us to get involved with an innovative technology called negative pressure wound therapy. And so we were the Texas distributor. And in that process of growing that business throughout Texas, we started hearing a lot of things about healthcare-associated infections. And we were asking ourselves, why do these things happen? And so we started flying all over the country, asking questions of hospitals that would talk to us about these things called healthcare-associated infections. And at the same time, there was legislation that was being passed that would really incentivize hospitals to do a better job where maybe Medicare thought that there were some deficits. But the reality is, it wasn't necessarily a hospital problem, we found out later. It's just kind of a culture, a healthcare. Not only that, but we have mutating bacteria and virus like we're dealing with today. We found this interesting concept that for so long maybe had been neglected. We'd done the same things over and over again as a country for the past 3 decades. And we thought, well, maybe there's an opportunity to bring something new to the table. We started, asking people what they were doing. And so we kind of looked at what the deficits were, and we found an opportunity in maybe filling some of those deficits. And later we changed our name from DermaCare, where we focused on wound care, to more reflect what our mission and passion had become. And that's providing some relief to hospitals, particularly those that don't have resources like the big hospitals, the rural and community hospitals. And so we changed our name from DermaCare, which started in 2006, to Infection Controls in 2009. And then later, we called our process, our program that we offer to our clients, GermBlast, and we trademarked that name as well in 2009.
So what are some of the services that you provide your clients now with that technology?
Most of our services are all wrapped up into the program. There are a few kind of bolt-ons, we call them, but the program itself is designed not only to provide what you would expect when you hear GermBlast, high-level disinfection for the environment, but also we recognize that there's a lot of contributing factors to acquisition of any kind of infection, particularly when it doesn't come from your own body, or we're not talking about foodborne, but we're talking about those that you acquire from the environment, different environments. Not just hospitals, but anywhere that we're at, there's bacteria that exist. And in that bacteria, there's pathogenic bacteria that can harm us. And so we want to figure out ways that we can lessen the likelihood of acquiring that bacteria that ultimately can harm us if we have a compromised immune system, or if it's something unique that our body's never seen. And so in addition to that high-level disinfection, we recognize that our certain behaviors that we engage in, or perhaps don't engage in day to day, can help alleviate this problem. And so we wanted to create maybe a public health campaign within our program that would help all stakeholders understand that they play a role in their own health. And so, the easiest example that I can give you would be hand washing. So many people understand the value of hand washing, but people don't do it. I mean, I know there's so many examples where people have been to a restaurant, go to the restroom, and have witnessed somebody just walk out without washing their hands. And that's an opportunity for us to wash our hands and eliminate some bacteria from our hands that can cause us to get sick when we eat. So if we can change behaviors, if we can reduce the pathogenic bacteria in the environment that can cause the illness, if we can create front-of-mind awareness to people that are working in those facilities or to their stakeholders, and if we can provide you with data. So that's another thing that we do is we collect data from the environment. something as simple as ATP, which helps us gives a good understanding of the cleanliness of an environment, to doing air sampling. And we can even tell you what specific bacteria you have in your environment if that's necessary. And so if I then give you all this information and charts and graphs over a period of time, you can make educated decisions on what to do in order to combat this problem that you now know is in your environment. And so by providing high-level disinfection, providing education to our clients, and providing them evidence-based information about what's happening in their environment day to day, and then creating this public health campaign related to infection prevention, you add all of those things together and you can significantly reduce the likelihood for infection. And so that's our goal, and that's the GermBlast program, essentially. That's a simplified version of it, of course. And then anything associated with infection prevention, our company engages in. So, devices that help reduce virus and bacteria in the air, for example, or allergens, or volatile organic compounds, things that can be harmful to your body. We sell products like that as well, and hand hygiene products, and there's a variety of things that we provide outside the program. We have a software, obviously GermStats, created by West Goldwater, and GermStats allows as its own software, its own program platform. You can gauge performance of your own staff on how they're doing in their day-to-day jobs, and so. The reason why that's important is it's everyone's goal to be better at what we do. And so if we can help them identify deficits in what they do day to day, they can utilize that information to grow their people. And that's our goal.
Yeah, it definitely seems like y'all are the experts in infection control. It's interesting that you not only provide that service, but like you said, you have the whole kind of gamut of public health campaign added to that, because it's not just about cleaning a surface, right? You've got to change behavior.
Absolutely. I think it all depends on what lens you look at it from. I think even given our current circumstances right now with COVID-19, if you're a doctor or a nurse versus, a business owner or, the mayor of a city, everybody looks at this differently. So when we look at infection prevention, we kind of looked at it from the lens of public health. It's not just about, doing a janitorial service. It's much more complex than that. And so we try to take the complexities of it and really make it something simple to follow. And we have public health professionals at our company. We have epidemiologists, biochemists, microbiologists. All of these people are continuously doing research, both on the efficacy of what it is that we do, trying to figure out better ways to do it, because we recognize that there's this huge evolution of technology that's coming. Not just in devices, but also chemical and methodologies. And so we want to be the best. We want to offer the best. And we want to offer the things that go good together. But the outcomes aren't just, I think what most people would expect the outcomes to be would be, reduced bacteria and virus in the environment that can harm us. But really the outcomes are reduced infection, right? So those are really two different things. You can have pathogenic bacteria in the environment and not have infection. And therefore you don't have a problem, really. The problem doesn't present itself until somebody gets sick. And so we work from, when you look at it from a public health perspective, we work from a lens of prevention is key. And the time to address the problem isn't when it happens. And so that's the value that our clients not only get from GermBlast, but provide to their stakeholders, is that they're doing something from a preventative standpoint to help reduce the likelihood of, diseases vary in severity. It could be something simple like hand, foot, and mouth, right? That'll go away pretty simply. But then you have staph and MRSA infections that people can become septic. And so nobody wants that. And so we help prevent the likelihood for that. We're not getting rid of everything. We're just statistically preventing the prevalence of those number of infections in our clients.
So for those clients, what types of clients are we talking about? Like, who could call you and say, I need your help. I need your services. Yeah. That's probably how they sound right now, right? They're like, I need your help.
Right. I'll tell you, when we first started, our focus was healthcare. We saw there's this culmination of legislation and of, this awakening to, things can be done to prevent healthcare associated infections. We work from the standpoint that zero is possible, although we've never gotten there, meaning that, zero infections is possible in a facility. But we want to journey that direction, and so because I've only done healthcare all of my life, I wanted us to be a healthcare company. I wanted us to be viewed as a healthcare company. And through the addition of some awesome teammates to our team, like Mike Motherill, for example, he's the vice president of education for our company. We had all of these school districts and colleges, universities calling us about these issues they had and that we would help them with. And I would push back on that a little bit, thinking we're a healthcare company. But what I realized later was that healthcare or health in general is for all people in all environments, for all populations. It's not, you don't have to be in a healthcare setting to be a health company. And so the two primary verticals that we serve as a company are healthcare and education. Education meaning K through 12, and then we do a lot of universities as well. And not just athletics where you see staph and MRSA infections, but in the classroom where attendance is essential in order to recognize your full academic potential. And so what we do for school districts is we help eliminate the number of illnesses that students experience, and by the way, teachers as well. And so if we can keep them in class, then we can prevent that interrupted learning, which causes kids problems. And so that's our goal. And we've seen significant effect of our program in those types of environments. And studies that were done by schools themselves have shown increases in attendance, or they call it ADA, average daily attendance, of up to 1.1%, but on average 0.5 to 0.6%, which it doesn't sound like a lot, but it's significant when you're talking about moving the needle a little bit to make a huge difference. And so when they've done and deployed all these different things that you can do in order to reduce that issue of illness, and then you add to it this intervention of GermBlast, people are seeing significant results. In fact, having done schools now for almost 10 years, we're in Texas alone, which Texas has roughly 1,250 school districts. We are in over 150.
Wow.
And growing, naturally growing fast. We've acquired so many new customers already for next school year.
I'm sure the phone's ringing off the hook.
It is. And I think that initially, GermBlast looks like something new. I mean, if you think about it, there's not, if I'm looking at a budget for the school district, you don't really see a line on them that would match anything that we do, right? And so a lot of folks in administration, they're wondering, where does the money come from? We can't just create it. But the reality is it just pays for itself. When you look at what are the values that we always say as a company, we want to enhance the product of our client, right? So if you think about a hospital, what is their product? Their product is healthy patients. And we directly contribute to that. And likewise in schools, what's the product? The product is educated students. Again, we directly contribute to that. And so you can literally put a return on your investment when you look at in a partnership with GermBlast versus essential things like pencils. You got to have a pencil to go to school, but what's the return on investment for that? It's essential, but I really can't measure that. You can measure what the effect is for partnering with a company like GermBlast. And so stepping back to your original question, every single business and residential client, I mean, anywhere you drive down the road and there's literally nobody you can find that would not benefit in some way from partnering with GermBlast. It's not something that you just do if you have a problem. Of course, we do that as well. But again, we focus on prevention. So if, for example, you have a family member who has cancer, right? And we've done this many, many times, and lots of clients will profess that GermBlast prevented them or their family member from getting sick. You have a compromised immune system. You can't get sick because that could be a significant issue for you. You have no immune system whatsoever. And there's a lot of diseases that have this issue. So you bring in GermBlast to help reduce the likelihood for acquisition of something bad from the environment that would make you sick and ultimately cause you to be hospitalized. And so you could literally the list never stops of people who can benefit.
Yeah, I'm sure I would have peace of mind knowing someone who, has the technology that's cleaned basically every OR in Lubbock, Texas is cleaning my home.
Right, exactly. Yes, we do essentially every OR room in Lubbock. And I think that speaks volumes to the healthcare providers in Lubbock. They see the value of prevention. And while there's essentially not an issue, do infections happen? Sure. But all of our healthcare providers in Lubbock, they see the value of prevention, and there's this, shared philosophy that we need to do everything we can to protect the people who are trusting their health to us. And so, yeah, every single entity in Lubbock that I can't think of one that provides surgical services that doesn't use GermBlast.
Wow.
Mm-hmm.
So let's nerd out a little bit. Let's talk about the technology. Okay. I'm really interested because I've read that it's clean, sustainable. In my mind, when I think of cleaning agents, when I think of Clorox, I think of like harsh chemicals. Maybe I shouldn't have just said Clorox, but we can't go back to now.
Well, to defend you, let's say this: the Clorox has a very valuable place in our society. It really does. But I see what you're saying. Like you're basically saying when you think of chemicals, you think of toxins, right? And I think that's kind of the stigma that's been put on disinfectants and pesticides. And to be honest with you, it's a very valid concern. I mean, people should be concerned about repeated exposures to any kind of chemical because we don't really know what happens to us after we have exposure in our home using the same chemical over 10 years, right? We just don't know. We don't know if it's a trigger, ultimately for some autoimmune disease or something. So it's a very valid concern. In fact, I'll tell you, there's so much research that goes into what it is that we do for our clients. And this is one thing I really want people who partner with GermBlast to know. This is an emphasis. We don't utilize anything, not a device, not a chemical, not even a process or protocol without first testing it. And so we have a huge team of researchers, and we will test it over and over and over again. In fact, there is a municipality in West Texas that wanted to utilize us, and they wanted us to use their chemical in our process. And we told them, while we would love to do business with you, we can't use your chemical, at least not right now. And so they really pushed for that because they felt comfortable utilizing that chemical. They vetted it, and they thought it was something that we should really use because they went through that vetting process. And we said the same thing. We can't use a chemical that has not yet been vetted by us. And we look at things like toxicity, safety, and what are the residual effects to the surfaces, all those kind of things when we research a chemical. Every chemical that we've utilized has been researched by Dr. Truitt's team. And so to answer your question specifically about toxicity, the two primary chemicals we utilize for disinfectant, one is isopropanol based product. And isopropanol, alcohol, most people are familiar with, and alcohol evaporates. So it really leaves nothing behind. And so it's extremely safe, and many food grade disinfectants, those that are NSF approved, for example, those products are alcohol based. A lot of them, not all of them, but a lot of them are alcohol based because it leaves no residual chemical that people can, ingest and harm themselves. The other product that we utilize primarily is a hydrogen peroxide based product. And so for all of our biochemists out there, they know hydrogen peroxide, the byproduct of hydrogen peroxide is oxygen and water. So very safe. And so there's a big, huge push these days for hydrogen peroxide-based products because of that reason. Very green. And so we deal with clients that have a lot of susceptible populations, right? You think about a hospital, you have a lot of sick people, they're susceptible. You think about school districts and you have children that don't have fully developed immune systems yet. And so we have to be very conscious of that. And we don't take manufacturers at their word when it comes to the toxicity of a chemical. We test it. And so if it doesn't meet the measure, we don't use it. And so all the chemicals we utilize meet that criteria. They're very safe. And so obviously you can't be in the room while we're treating, but literally when we're finished, you can walk in and feel confident in the fact that there's nothing toxic that can harm you or your children as you breathe the air or you touch a surface. You have a team, like you said, that does research and looks at all of those properties. Is that based here in Lubbock? It is, yes, absolutely. Our company is based in Lubbock. We started GermBlast, as we're known, we started GermBlast from scratch. There was no Me Too's out there that we can look to say, how do we do this? Everything that we do it was created by us in terms of processes. And outcomes. So everything's here in Lubbock. And in fact, I'll mention a shout out here to Lita. Through some of the grants that we received early on in our business, we were able to hire some truly remarkable folks. And so that helped us out tremendously. So Dr. Truitt runs the science program, the lab, the research program. Dr. Truitt's also the science director at Wayland Baptist University. and highly decorated. He in terms of doing peer-reviewed research. He has done research with hospitals to kind of vet different methodologies for disinfection. He's the leader. He's actually a nationwide keynote speaker for many of the associations that the top associations for infection prevention. So there's the Association for the Healthcare Environment. He's been a keynote speaker. The Association for Professionals in Infection Control and Epidemiology. He's been a keynote speaker. He travels the country representing GermBlast and talking about best practices. Everything, corporate offices here. We have a local operations center here for West Texas. In addition to that, we have 4 additional offices in Texas, in El Paso, Austin, Dallas, and Houston. We're opening one very soon, kind of near San Antonio. But on that note, I can also say here, first time to be heard, social media elsewhere, that we are re-engaging in the franchise process. We have about a dozen people who are ready to sign right now for franchises across the country. And we will probably start that in the next 30 days.
Wow, that's incredible.
Yeah, it's awesome. We're really excited.
Yeah, well, we're excited that we were able to announce that here on our podcast.
And corporate office is right here in Lubbock. Yeah, all downtown, as a matter of fact.
Yeah. What do y'all like about doing business in Lubbock or having your headquarters in Lubbock?
Well, number one, it's home, right? But we could choose to make home anywhere, especially where, there's huge populations. Lots of companies would have their business in Dallas-Fort Worth, for example. But one thing I could say about Lubbock is the people here are amazing. And there's such a huge resource, not just in the types of employees and the value that they can provide to a company, but you have Texas Tech, you have a great government that supports business. I think that the primary values of our company are kind of shared within the community, so it's a really good fit for us. We want to hang our hat here, and we want to create business for Lubbock. And I think that that kind of is one of our tenets. Like we want to make sure that we support local, and we feel like Lubbock has so much to offer that there's really no other reason to go to a larger city. We can get everything we need right here.
So looking forward, where do you see GermBlast in the next? I guess I should say 5 years rather than 10, because with the phone ringing off the hook, you may just be thinking, what's my 3 o'clock today?
Right. 3 months ago, I'm sure the answer to that question would be much, much different. With this recent pandemic, to be honest with you, I really feel like a lot's up in the air. Because at the same time, when we're developing strategy and trying to implement the 5 and 10 year plan, we are also, like everyone else in society, we're trying to figure out how to make everything work. And so I don't think 5 years really looks different for us than we had anticipated. It probably looks bigger. We probably have a larger geographical footprint because of the franchising. But I don't think our mission changes. Our mission is the same. We want to, our primary goal is to affect the health of people as it relates to acquisition of illness and infection. And the way that we do that might change. The quantity will change in terms of volume of business, but I feel like that what COVID-19 has done is kind of it's an awakening for everybody to understand that prevention is valuable, and not just prevention with what we do, but there's a tremendous number of things that I think now are being looked at from science, from a science perspective, from a political perspective, and so I think a lot of things will look different 5 years from now in this industry, our industry being that of high-level disinfection. So we're going to roll the punches, and we're going to be an innovator, and we're creating our own devices, and we're getting our own patents, and so we want to be a contributor to whatever that innovation looks like for the next 5 years, and rather than just being a participant.
Well, I know we're happy to have the expert for infection prevention and control right here in Lubbock, Texas. So we appreciate you being here. Yeah.
It's my pleasure. Absolutely.
Well, I would be remiss, and the Hamill Bros would be very upset with me if I didn't mention that any doors shutting you might hear during this podcast, we are actually filming this in a new location. It's in the beautiful DoubleTree by Hilton in downtown Lubbock. We're super excited to be here, especially because our friend Chef Tony is hanging out with us, and we've got some legit food that we're getting in backstage. So we're like having the best time. But anyway, so
and it's beautiful in here.
It is. It's gorgeous. Yeah. I mean, great light. why it's going to be fantastic when this opens later this year. So we're really excited.
Yes.
But all right, we'll catch y'all later. Hub City Spokes is produced by the Lubbock Economic Development Alliance in partnership with Hamel Bros Studios. Special thanks to the DoubleTree by Hilton for hosting us here in downtown Lubbock. For more episodes and to subscribe, go to lubbockeda.org/podcast.